Don't miss that!
Welcome back to Don't Miss That Radiology. I'm Dr. Matt Hartman, and this is Episode 8, How to Study Radiology. This episode is a little different. Instead of teaching you how to interpret X-ray or CT scans, I want to teach you how to become someone who can. Over the years, I've worked with hundreds of medical students and residents, and I've noticed something. The students who succeed aren't necessarily the ones who memorize the most. They're the ones who develop a system. Today, I'm going to share 10 principles that have helped my students build confidence, recognizing patterns, and think like radiologists. Let's get started. So the first thing is we have to start with the big picture. You have to know the normal first. Radiology isn't about memorizing diseases. It's about recognizing patterns. You need to have a systematic approach. Don't wing it. And we've already learned some basics. How to read a KUB or abdominal radiograph. Stones, bones, mass, and gas. And I cannot emphasize this enough. Lines and tubes first for whatever your study you're doing, whether it's a KUB, a chest x-ray, or a CT scan. So our approach for a chest x-ray was the A, B, C, D, E, F. But, caveat, start with lines and tubes first. So A, airway, B, bones, C, cardiac/mediastinum, diaphragm, looking for a pneumothorax, that deep sulcus sign we talked about on the supine radiograph, continuous diaphragm sign for pneumomediastinum, E, everything else, that's going to be our soft tissues, and then we save the best for last, lung fields. So study smart. The best advice I got from my father, David Hartman, who's also a radiologist, told me to study 2 to 3 hours each day. Quality is more important than quantity. And process learning is better than passive studying, so make it active learning. And it really doesn't matter what that 2 to 3 hours is, and I'll talk about some of my favorite resources. So active learning is way more important than passive learning. That's why I always like quiz cases. That's one of the reasons I designed the book the way I did. Lots of questions that you can quiz yourself. I love that. And when you go to the reading room the next day, invariably you'll be asked some of those questions. And when you know the answer and look like a superstar, that just feeds on itself. And for me, that was fantastic. Very important. Whatever is important will be repeated. I'm always telling this to my residents and med students, that you are not just going to see this one time. Whatever is important will be repeated. I'll repeat that one more time. Whatever is important will be repeated. So we've already talked about some important principles with the lungs being too white, blood, water, cells, pus. We just reviewed how to review the different studies for KUB or chest x-ray. And I just learned this from one of my students, the Pancake Principle. 3 pancakes every day beats 20 once a month. And sort of the analogy goes, if you're asked to eat 3 pancakes each day, the first couple days, not a problem. You skip a couple days, and then you're on Saturday, and you got 12 pancakes on your plate. And you're like, man, I can only eat 3. And you skip another day, and by the end of the month, you got a whole stack of 21 pancakes. No way you can do that in one day. So slow and steady. And I always tell my med students and residents, try to learn 3 pearls every day. Small daily improvements will lead to expertise. And I always tell them to write these down, whether it's physically writing it down, putting it in flashcards, whatever. But it's sort of like compound interest. You do 3 each day. By the end of the year, you've learned over 900 pearls. And that's pretty awesome. So what are my favorite resources? Well, as a member at AMSR, we developed Anki decks for the regular course, which covers the learning objectives, as well as the Rad Path course. These were designed by students, for students, with some input from myself, and very, very high reviews for these. And I'll tell you, the regular deck is based on the AMSR learning objectives, and if you're at a place that is giving the AMSR Star Shelf exam, that's what it's based on, and our AMSR cards cover that perfectly. My favorite book as a med student was Felson's for how to read a chest x-ray. I still have it. I still tell all the med students and residents to read and reread it. It is fantastic. Radiopedia has some great resources. If you're ever thinking about a topic, someone asks you about, I know I talked about this the other day, XGPN, xanthogranulomatous pyelonephritis. You're like, what's that? Well, look it up on Radiopedia. And I had my students do that. They have a great example there. We actually turned that into our own TikTok, and it's one of my favorite diagnoses. This podcast, I think we got some great stuff on here. If you're using this, if you're driving, if you're exercising now, or on the bus or driving to work, this is free learning. And the UBC app is fantastic. I used to use this a couple of years ago with all my med students, and then the app went defunct for a little bit, but it's back. And what it does really well is the normal anatomy. That was our first thing. Got to know the normal anatomy. So they are anatomy quizzes on there. I have not seen anything better than this. This is completely free. Also a section on what test to order. This is fantastic. So here is an example from our Anki RadPath deck. This, in my opinion, is outstanding for anyone who's on my RadPath rotation. It's a must. But if you've already had one radiology rotation, you're looking for more, or you're a radiology resident just starting out again, this is a little bit higher level learning, and I think we got some great stuff on there, a lot of anatomy, a lot of pathology. So, create a study system. Everyone learns a little bit differently, but I think the key common factor is repetition. And I'm a big fan of writing it down. So I realized when I was studying this 25 years ago, there was no Anki. I had to write my own flashcards. I actually made PowerPoint flashcards, which was sort of the precursor of Anki. We didn't have the spaced repetition, but I would make my own flashcards on the computer because radiology is such a visual field. It's so easy. If you see a great thing on Radiopedia, any of my YouTube videos, take a screenshot, put it into your deck. That's the way to learn. And secret: review, repeat. 2 to 3 hours each day, 3 pearls each day. You're going to know a lot of radiology. So trust the process. Compare yourself only to yesterday. And you got this. This sounds very similar to my swim coach, who always said trust the process. I didn't really know what that meant at the time, but it's true. Repetition, being consistent, you will improve. You got this. Don't just memorize, think like a radiologist, and we'll see you next week. Thanks for listening to the Don't Miss That Radiology podcast. I'm Dr. Matthew Hartman. Remember, you only see what you know. Keep learning, and don't miss that.